Healthcare is under tremendous pressure, too many complex decisions, not enough specialist time. At UDiagnose, our mission is to transform healthcare using Agentic AI so every patient benefits from specialist level decision making, not just the lucky few. Today, decision making capacity grows incrementally through recruitment and training. Agentic AI changes the curve. They let the capacity grow exponentially while keeping the clinicians firmly in control. We focus on three goals: patient self-management at home, remote monitoring in community, and AI-assisted workflow in hospitals, virtual wards, or GP practices, so that clinicians can make faster, better decisions and increase the throughput. Let me show you what we mean by digital specialist agent. We have built a library of condition-specific clinic agents. For example, breast clinic or the family history breast agents, LUTS or chronic pelvic agents, erectile dysfunction and pediatric assessment agents, as well as frailty and dementia assessment agents. These are designed for cases where a generic GP or emergency assessment is not enough. Each agent runs a deep, structured consultation. It collects symptoms, risk factors, lifestyle in greater details than tools like NHS 111, and then generates digital risk assessment, triage distance, and predictions of likely predictions or the diagnosis or the diseases and pathways. For cancer suspects, we have got 2-week wait pathway referral agents. These agents focuses on red flag features such as bleeding, prior cancer, and recommends the right pathway in investigations and packages all of this for the specialist team to review. We also have got automated procedural counseling and multidisciplinary planning. Procedural agents explain indication, alternatives, risks, complications, and realistic recovery timelines, including when a patient is expected to return to work, improving the understanding and reducing the complaints. We have got MDM agents, which brings together input from the surgeon, oncologist, radiologist, therapist to stage cancers, account the comorbidities, patient preferences to recommend a coherent care plan for the patient. Finally, post-operative and community monitoring agents keep the patient safe after discharge. Let me show you our breast specialist agent that has been designed by the NHS specialists who have mapped best practice guidelines and their own tacit knowledge in structuring the agent's question flow. As you can see, the agent doesn't just ask a few headline symptoms. It moves through a carefully ordered set of questions covering history, red flag, comorbidities, medications, lifestyle, which hasn't been shown here deliberately to keep the conversation very crisp and concise. This structure means that the key details are not missed just because a human is rushed. At the end, the agent will always ask, is there anything else you'd like to say, like to tell us? So that the patient can add their symptoms, worries, and practical issues that were not captured by the closed questions. To make this more usable for a real patient, we layer in simple audiovisual aids for questions which are complex. The agent can display a short clip, icon, images so people can understand what the question means. For example, showing different types of breast changes or explaining the unintentional weight loss, what does it mean? This reduces the misunderstanding, improves the quality of the answers, which is critical for patient safety. The agent also looks beyond the local symptoms. If the patient reports weight loss, night sweat, breathlessness, it proactively asks these even if they do not seem directly linked to breast. Those apparent separate clues often change the risk picture, and the agent is designed to bring all of them together in a way in a time-pressed clinic often cannot bring this. So for this demo, I have used a test patient. You can see with the information collected. Once the interview is finished, the agent runs the specialist grade risk assessment. It triages the case, estimates the 5-year, 10-year lifetime risk of the cancer, and generates predictions of most likely diagnostic categories. Even imaging such as ultrasound mammogram is negative. This output is a comprehensive risk score, suggestive pathway, and narrative summary for the consultant review. Helps to catch the high-risk cases earlier and reduces the missed disease incidences. Our multimodal AI agent differed from superficial symptom checkers. Those tools mostly collect a few symptoms and signposts. In contrast, our agent runs structured, comprehensive data gathering, risk assessment, multimodal risk analysis, predictions, and actually execute the tasks afterwards. You have just now seen how the agents gather rich clinical data. Now I will show you task execution and what it enables. The agent can automatically call the patient when you simply need the results. Follow up that call with a clear letter, send SMS, email reminders for appointment, tests, self-management guidelines, and advisory to the patient.
Hello, Amelia. We're calling from Watford Central Medical Center about your recent care. Can you talk for a moment?
Yes, of course.
Can you tell me your passcode, please?
It is P for Papa 001.
Thank you. I've confirmed your identity. I'm calling about the results from your MDT meeting. The review confirmed that the liver lesion is benign and represents focal nodular hyperplasia. There's no need for a biopsy or resection. You'll be discharged from MDT follow-up and can continue routine care with your GP and hepatology clinic as needed.
Oh, that's good news for me. But I don't remember what were my original symptoms. Do you know anything?
Yes, your original symptoms included new onset tiredness and right-sided discomfort, noted during your GP consultation on 12/01/2026. Is there anything else you'd like to discuss?
I wanted to know who were the doctors and specialists involved in my care planning.
Your care involved several clinicians. Dr. Fiona Green, GP partner. Dr. Imaging Dept, radiology team. Dr. Emily Ward, radiologist. Dr. Helen Carter, consultant hepatologist. Nurse Laura King, hepatology clinical nurse specialist. Let me know if you have any more questions.
Just last question is that what are the things that has been done so far for this condition?
So far, you've had a GP consultation, an abdominal ultrasound, an MRI for characterization of the lesion, a specialist hepatology review, and a nurse check-in.
Well, that's everything I wanted to know today.
Lovely. It's been a pleasure speaking with you. Let me just wrap things up. We discussed your benign liver lesion results and the symptoms you experienced. The care planning involved several specialists. If you have any questions, you can reach us on your clinical team. Take care. Goodbye.
These automation frees up the staff time and let hospital run more efficiently in a lean way. In our outpatient models, even the lowest possible level of implementation delivers about 57% cost saving compared to standard pathways, and more advanced deployment that include clinician training can increase this further. By AI training, I mean our dedicated clinician training module. These modules designed with the investors in learning use videos and interactive cases to teach doctors and specialists how to work with AI safely, how to apply the best practices, recognize and prevent hallucinations, and challenge the AI agent when needed, and maintain the shared accountability. Together with Lizzie Lowenstein, the CEO of Investors in Learning, we have developed this program so clinicians can improve their efficiency while keeping the patient safe. Let me finish with what is possible when we use agentic AI at scale. With agentic AI, work, decision making capacity, and speed, all three increase together, and the depth of the analysis increases as well. Instead of adding capacity of one clinician at a time, we can multiply it tangentially. In our modeling, agentic AI can deliver up to a 11614 increase in the decision making capacity and processing speed, enabling far faster and more consistent decisions. For patients, that means hyper personalized care at their fingertip, proactive preventative support rather than reactive crisis management. Imagine this deployed nationally. The entire daily workload of every accident emergency department in the UK could be processed in a few hours, with the AI agent doing the heavy lifting on history taking, risk assessment, and prioritization. But the real shift is structural. Instead of thousands of scattered entry points, each building their own queues, we can build a unified national contact and data center. Agentic AI can categorize each patient, match to their right level of care, and route them to the facility where right expertise and capacity exists. That means fewer bottlenecks, better use of the scarce specialists, and faster and more convenient and more cost effective experience for patients, clinicians, and payers. This is the future we are building towards with UDiagnose and our ecosystem of agentic AI. Thank you.